Right. Good morning once again to all the participants today, the panelists, speakers, members of the IIT Alumni Association, industry representatives, and other affiliates. It gives great pleasure to me to be part of this program today, which is celebrating STEM in our field. And this program has been powered by women of this association. This program is also in collaboration with the National Academy of Sciences. As you all know, 8th of March is celebrated as the International Women's Day by the United Nations. And the background of the celebration goes back to the early 1900s, even before the World War, where women recognized the need to be equally participative in the workforce. The core focus of the Women's Day changes every year. There is a theme which is announced, and every year that area is taken as a area to ideate about. So for the year 24, the theme has been Inspired Inclusivity, which I think is very relevant because, of course, women have started taking initiative to come forward, but becoming inclusive in a work environment and working as a team is a much larger concept, and it requires the entire sisterhood, let me say, to come together to really deliver on inclusivity as well as participation from the other folks which make a workspace. Having said that, in India, about 47% of women who graduate from STEM programs of the total ecosystem, but only 27% participate in STEM-related workspace. So there's something still to think about where the dropouts happen. So today we have some of the very eminent speakers who work in the field of science, and we will take you through what's the action-packed sequence for the day subsequently. But first, I'll invite Professor Ashok Mishra, the president of IIT AC, to come and say a few words on this inaugural session. Thank you.
So a very good morning to all of you, and I'm actually wearing two hats. I'm the president of this IIT Alumni Center Bengaluru, IIT ACB as call it, and I'm also the chairman of the National Academy of Science India Bangalore chapter. So because of that, several programs we have organized together, and this is one of them. So first of all, I'll talk about IIT ACB. And as you have seen, the building has come up quite nicely. It was launched in September last year with very eminent speakers like Mr. Narayan Murthy, Nandanil Keni, and Chris Gopalakrishnan. And it was a very nice, power-packed 1.5-day sessions where we launched the building. And since then, several activities have been happening. Very soon after that, on September 30th, we had our first seminar. We have had several seminars earlier, but the first seminar on the premises, and this was on artificial intelligence, covering several areas of artificial intelligence, from bill payments, from health, to several other areas, drones and agriculture and whatnot. Very, very nice one-day program we had. Again, we had very eminent speakers for that program. Now, IIT Alumni Center basically is, of course, as the name implies, would be a place where IIT alumni will get together, network, and so on. But our main focus is to promote science and engineering, science and technology between the industries, the academia, especially the IITs in this case, and the students. And this we have been doing. So we have several industrial partners, we have several institutional partners, we have several institutional members from the academia, and we are trying to bring this together to take it to the next level. On the other hand, the National Academy of Science, India, NASI, there are 3 national academies in India. If you don't know that, National Academy of Science is the oldest one, started by Professor Meghnad Saha. and we'll be celebrating our 90th year very soon. After that, the Indian Academy of Science started in Bangalore, and then the Indian National Academy of Science, INSA, which is in Delhi. So why we have three, that's a different matter. But we have three academies, but we are the oldest. Our main focus, every academy has several common themes, but our main focus is the popularization of science, how we can bring science to the students, bring science to the colleges, to schools, and the like, so that the next generation is inspired to take up science subjects, not just girls, but even boy students, which is a much needed requirement for the country, so that we are leading nation in terms of, we can say Viksit Bharat, this, that, made in India and whatnot, but we have to have the youngsters who will be involved and engaged in science, because science is the basis for all technology to grow. And then of course engineering and so on comes in play. So NASI interacts with the other two academies, and they have formed what they call as the STEM, science, technology, women in science, technology, medicine, across three of the academies. And they also have a portal called Swati, which is Women in Science and Innovation. So overall, we are, can you hear me in the back? It's okay? Okay, good. So overall, we are very proud of the number of scientists that we have in the country. And over the last 2 decades, the number of scientists from the women's sector has increased tremendously. I was director of IIT Bombay, and I was seeing that the number of faculty members has increased, the number of students joining PhD programs from the girl students increased, and so therefore we are on the right path. What we all know is that the brain power has no discrimination of sex. There are women and men, they are both equally bright in all colleges and schools. It's just the opportunity and the social structure which has to work out. Now, we are very thankful to some of the leading scientists from the Bangalore region who have agreed to give presentations today. They are all leading people in their respective fields, and we are again very proud that they are from Bangalore. We had a list of several people to call, but then we found enough in our city, and there are several more, so we can actually have a second seminar again with the women scientists within the country. So without further ado, we would like to hear from them. We want to see what great things they are doing. One of the sectors which we try to cover several sectors in the Bangalore region, several institutions as well as some industries, but unfortunately we couldn't get scientists from ISRO. ISRO is very big in terms of women scientists who are involved in their programs, the Chandrayaan, the solar mission Aditya program, and the older mission to the Mars and so on. And they are doing a fantastic job in ISRO. So without further ado, let us begin the program with our leading women scientists. Along with their good work that they are doing, they also have to work with the rest of us to see that more women students join research and take the country forward. So with this, let the sessions begin, and I hope you will all enjoy it, and thank you for all the audience who have come to take part in this great event. Thank you so much. I must mention that we also make efforts to call people from colleges and schools to attend such programs, on behalf of NASI, that is. Okay.
Thank you, Mr. Mishra. So now we look forward to the sessions. So we have planned about 7 sessions today, which are categorized into 3. The first session will focus on AI and health, followed by astronomy and nature. Then post-lunch, we have a panel discussion, which will be moderated by Sushila Venkatraman. And the final part is focused on molecules, regulations, and quantum. So the first speaker for the day is Professor Prabhdeep Kaur. Just let me introduce her to you. Dr. Prabhdeep Kaur is a physician and public health professional, currently working as a professor at ISEC Center for Public Health, Indian Institute of Science, Bangalore. Before joining IISc, she was a senior scientist, head division of non-communicable diseases, and course coordinator for the field of epidemiology, training programs, fellowship programs at ICMR, National Institute, Chennai. She has 20 years of experience in this field and worked in many areas, and she's conducted several outbreak investigations to strengthen public health surveillance for infectious diseases. She was a member of the Chief Minister's Expert Task Force for COVID-19 control in Tamil Nadu. She was the principal investigator for India Hypertension Control Initiative, a multi-partner public health initiative implemented in 150 plus districts across 24 states to improve hypertension treatment and control. She is also a member of the WHO's Global Cervical Cancer Elimination Expert Group and has published over 85 papers together in national and international peer-reviewed journals. So put your hands together for Dr. Prabhdeep Kaur from IISc.
Very good morning to all. First of all, I would like to thank Professor Ashok Mishra. I met him recently at a NASI symposium in Mumbai. That's where I came to know about all the work that he has done to promote science, and very thankful that he's doing this to promote women in science. I think it's much needed. So first of all, I don't know, you all are from diverse backgrounds, and I being a physician, I understand the core of this event is around STEM, but I think medical science and public health are really very, very important part of science, and so I'm really happy to be here. When they asked me the topic I wanted to talk about, like I can talk about public health, then I thought that since this event is around women, so one of the things which is very close to my heart, and I think it has become all the more important in the recent years as I have grown in my career, is really understanding pathways why women are not there. If we say women are not there in some places, why are they not there? And if they are there, then why do they have challenges in growing? And I think there is some knowledge now and more published literature coming around it, and around which there is not much of awareness. So I felt this is an opportunity to share some of the sort of what is the evidence we have, right, from the data and also from the literature. And I'm drawing a lot from the health, but that's a sector I understand better. But I also understand when I looked at the literature that the challenges seem to be very similar, although slightly different across the sector. But I think what ties women together more than the sector is actually the social context in which they live. So when you look at the challenges, like one of the paper that I was referring to while preparing for this talk, I realized that the challenges which women in health face were similar to challenges women were facing as software professionals. And when you actually look at those challenges, they are not technical, right? They are actually linked to the social milieu and the socio-cultural context in which they work. So I guess there will be some parallels that you will see, some things may be unique, but really to open this conversation, and maybe then you can come up with more ideas around that. So I recently joined Indian Institute of Science. I'm very new to Bangalore. So yeah, it took me an hour to come. That was very short, I guess, for the traffic in Bangalore. So very happy to be here. So I think I will just little bit start with the big picture on, I think she already set the stage by saying that workforce participation, I think that is the starting point. When we talk about leadership, it's not going to happen if women are not even there in the workforce. Really setting the big picture, looking at challenges, but then also solutions. What is that we can do to help women enter the workforce but also stay and grow in the workforce, and learnings from my own journey. And finally, being a public health professional, I find it's not complete for me to talk if I don't mention importance of health. So I think I will end with my thoughts on women's health. So what is the biggest change which has happened in our times? And when we look at it as public health professionals, if you entered public health in 70s and 80s, the only thing you worked on was family planning. So when we talked to our seniors, they said, like, if you were in a public health program, you were under so much pressure to actually achieve the targets of family planning. And that seemed to be, India was so worried that, our population was exploding and we will not be able to cope with the challenges. But women proved all the predictions about India wrong. And like very recently I was reading an article, it's very impressive to see how women have been champions of family planning. Because in India, when you look at the data from National Family Health Survey, most of the family planning is because of the women's initiative, right? So most of it is due to sterilization and not due to other methods where men participate. So I think the biggest achievement, if you ask me, that what women has done in the past 50 years in India is actually brought the family size down, which has helped the country. But is it really helping women? It means that now they have more time to participate in activities beyond home. We all know that, our grandmothers, great-grandmothers had big families to look after, 8 children, 10 children. It's not rare to hear the stories of, how they struggled and they had to cook for 10 people. None of us are doing that. But then is that extra time really being used for other pursuits? And if not, then where is the problem? So this is really impressive. And when you look at it's across the country, right? And interestingly, I didn't put the chart here, it is across the socioeconomic groups. So especially when you look at southern states, the family size is below 2, even for women from the lower income groups. So what it tells you is that women have really embraced the idea of a small family size and also gone up in the education, right? So all these two are the biggest enablers. So as we get into all the other issues, not to forget that we have done the difficult thing already. And whatever else we need to do to promote women's growth, either in education or professional domains, that cannot be as difficult as this was. And this is also at a time in India when we did not have great public health programs, great resources, and education. So, but this is the truth. The global report says it's going to take 257 years. That's not very encouraging to actually eliminate the gender gap in workforce. And that's very scary, right? And where are we? We are at 112th, which is very, very sad. So when my mother was a school teacher, and every woman in my family was working, because my grandfather, my maternal grandfather, who was a bank, although he came from a farming background, I'm from Punjab and most people in Punjab were in farming, he actually was working in a bank, and his bosses were all British, and their daughters and wives were very educated. So he was very impressed. So he told his wife that I want all my daughters to be like these girls, and he got them educated. And in 1970s, I'm talking 60s and 70s, they entered the workforce, and all my mother's sisters, everybody was working. It was very normal for me to have working women in the family. But what I realized that by the time I came to workforce, I was struggling to keep my team members in the workforce, which was very strange to me. I thought by now we had solved the problem. Like, it was problem of my mother's generation, not my generation. But it's not the truth. Women are not really staying in the workforce, and what's happening? It's declining, right? You would have really thought that this graph would have gone up, This is our own India data from 1990 to 2019. And you can clearly see there is a decline in the workforce participation. So there is something going on, and of course we all are busy doing our own things and we are not able to really figure out. But I think it's important for us to reflect on why it is happening and what can be done about it. And why is it important for women to stay in the workforce? And quite often I have to face these questions from my own staff. Like, there are girls who have come and told me that, no, my mother-in-law says, now you quit. And this is quite often, like girls, they come, they're doing really well in your team, and they get married, and then they suddenly want to go away. Or, once they have their first pregnancy, they leave the workforce. So I'm sure all of you who have had teams, you would have experienced these anecdotal experiences. But importance of financial independence, which a lot of women understand, but are not able to emphasize it enough in their social and family environments. And I try to give all the rationale, and nowadays this is the most common rationale I give them. That's why I just put it there. So I tell them, okay, fine, you are married. Let's say you have a child. Let's say by 30 you're married and you have kids. Your kid is going to grow up in 15 years and you will be 45. What will you do after that? You can still work for 20 years after that, right? On an average, now we have women life expectancy of 70 to 75. And you will be surprised that many of them, they're like, I never thought of it. Many girls have come back and told me that I didn't think about it, because they are just so overwhelmed with that idea of getting past that barrier of fitting into the family and trying to satisfy everyone's expectations. So since I find this to be a very strong argument, so I'm just putting it here, which you may use it with people when they come to you for such questions. But I think this is really, from a public health perspective, an important issue, that actually women now have many more years beyond their parenting, which is linked to our family size, because it's a small family size, maximum 2 children, they are grown up by the time they are in mid-40s, and women actually have nearly 20 years on an average of time when they can spend in the workforce. So I think from a policy perspective, this is an important issue, because we didn't think about it. So everyone talks about, women are dropping out and that's all, it's over. It's not over actually. It's like you have to really think, can you bring them back? Because still there is so much time when they can continue to contribute. And more importantly, what I find, I've also had people in my team who have been through breaks, come back and done well in their 50s. Like, I have women who took 5-6 year breaks and really fought their way back. And despite whatever be the age, like I had somebody in my team who was 50 and who will be very comfortable sitting and learning from people who are 35, right? But she did really well, and she's very satisfied, because I think at that stage, it's when women actually start thinking about their identity, their recognition of their needs beyond what they have done for their family, and the whole importance of meaning in life. So I think we need to take a very broader perspective as we discuss this issue of how we can help women stay in workforce and grow in workforce. But what is the reality? So I thought, let's look at the big level things since we have diverse audience here. So I just took few examples as our first introductory remarks. She mentioned about STEM. So I looked at one example from administrative services, because I have some of my friends, colleagues who are in administrative services, and they used to often tell me that there was a time that women had a lot of difficulty actually in entering administrative services, because they said you will not be okay with the transfers. They have to get transferred every 3 years. And as you can see, we have made progress, gone from 10% to 30%. This was a very recent data, the 30% in 2020. But what is striking is that there have been only 2 women chief secretaries in the civil services. And I know one of them. She was in Punjab, very, very sort of inspiring woman. Her name is Miss Vinnie Mahajan. And she interacting with her, you realize, how difficult it is actually for women to be in that position, despite having gotten through all the barriers, getting into the IAS and reaching highest level, they still face challenges. And India has never had a cabinet secretary until today. So problem is there. Even if you enter the workforce, it doesn't mean that you can actually get to the leadership positions. And I think this was already mentioned, India has 43% science STEM graduates, science, engineering, maths, but what is happening to them, when you look at the scientific researchers, and I think you mentioned the data, which includes possibly all related workforce, but science, it's only about 14%, and when you look at women as authors, again, it's 15%. So there seems to be huge dropout. Although they graduate, some of them may go to corporate job and others, but I think all put together, there is still about 20% gap which need to be addressed. We have a peculiar problem in health. So unlike any other field, if you enter into a hospital, you only see women. It's like, you rarely see men. There is a nurse, there is a secretary, there is a, staff, housekeeping staff, and you enter any health facility, you are likely to see only women, right? Because they constitute most of the workforce. But in the last few years, there have been a lot of, hue and cry that, okay, fine, we are all there, we are doing all the jobs across every type of health sector that you can think of, but are women really reaching leadership positions within health? And the answer is no. So they are at the bottom. So that's what this particular very interesting article talked about. Women in the global health are labor, but not the leaders. So they seem to be concentrated more at the bottom of the pyramid. So if you look at across, and this is based on a very rigorous analysis where they looked at, this is a global report, which looked at all the different data sets. So when you look at nurses, women are 80%. When you look at health workers, women are 70%. But when you look at deans of top 20 public health or medical schools, it comes down to 30%. And then executive heads of global health organization, it's again about 30%. And if you look at Fortune 500 healthcare companies, I think we have few people from corporate today afternoon. Anita is also talking, I know her, from Biocon. It's only 12%. So there is something wrong somewhere. It cannot be that, if there are so many women entering the work, and here, interestingly, unlike STEM, in health, women are actually entering the workforce. But they seem to be stagnating at various levels in their careers, but not able to reach the policy level or not able to reach positions where they can make decisions. And interesting anecdote from my own experience, I've been involved a lot with the cervical cancer program in India. And as you know, the government of India recently launched HPV vaccine, which just happened very, very recently. I mean, we are almost 14 years behind. We should have done this 15 years ago. And every time for this cervical cancer vaccination meeting I was part of, there was hardly any woman. So I was wondering, whether we are not going to get this vaccine, because the discussion was always around issues which were not so important. And really the focus should have been on saving lives for women from preventable cancer. I'll not get more into that because it's been a highly controversial vaccine. But to make the point that quite often the decisions are not made by women. So the way they perceive, the way people at the decision table may perceive the problem can actually be influenced by your gender. Because you can see the problem very differently when you see it from your own lived experience or from your own gender perspective. So sometimes in health, it becomes very, very critical issue that you actually take into account a more balanced view when you are making policies. So in context of health, when we don't have women leadership, it's been globally recognized as a very serious problem. And very interestingly, as a response to that, there have been now 2 or 3 global international NGOs which are typically focusing on this issue. So they're trying to see what can be done to actually address this huge gap. And there are 2 or 3 big NGOs, and one of them is Women Lift Health, which was launched about 2-3 years ago. And I'm very fortunate to be part of their first cohort, where they took mid-career women and they actually wanted to sort of mentor them for leadership position. And I'm very happy that today 2 of us, Anita is also doing a talk in the afternoon. She was part of the same cohort as me. So what they really wanted to look at was that what is preventing that progression, and are there any pointers as to something. It's not about just going on saying problem is there, but do we have the solutions? So there have been a lot of research studies that they have been doing, and I actually wanted to share some of the findings from a very good study which was done recently by their team. So this was a very good study, and I think a very sort of comprehensive one, and I really wish such studies should be done in other sectors in STEM and other fields as well. So what they did was they actually did this study across 3 settings: India, East Africa, and North America, and they did 79 individual interviews and 153 through a survey. And this has a fairly large sample from India. 69 women in this are from India. And these are mid-career women, like people who have 10 to 20 years of experience. They didn't take very senior and very junior, because that's where your the growth path is set. So they also try to take the people from very diverse sectors within health, from the public, private, research, academia, corporate, and so on, and to understand whether there are differences or whether there are some overlaps in what's going on in this space. And what they found was that, very interestingly, there were 3 enablers. Actually, women identified 3 enablers. And these 3 enablers were, first and foremost, was mentors. And it was very interesting to note that the participants from India highlighted the importance of women mentors. Although globally, like for example, the North America participants equally mentioned men and women mentors. But the participants from India actually said that their career was more facilitated when they had a woman mentor. And this woman mentor could either be boss, but need not be. It could also be an informal relationship from a colleague, from someone you trained under, or someone you get introduced to in a professional network. But they felt that that push from someone who could understand their journey helped them a lot. The second interesting thing they mentioned was the importance of professional networks, that quite often women found it very difficult to engage with the professional networks due to the time constraints, due to the family responsibilities, travel, and so on. And engagement with other women in the similar professional fields and ability to connect, not just for job. I mean, getting jobs and all was one part of it, technical learning. But they felt that that connection actually helped them feel more confident about themselves and help their career progression. And the third important enabler was leadership qualities of people under whom they worked. And they found that those who found their supervisor, their managers, their bosses to be more empathetic and more understanding as they went through difficult challenges. It could be your child being sick, or a home responsibility, that extra leave you have to take because of problem at home, or whatever it is, or you could not stay, let's say, beyond 6 o'clock or something. So they felt that when they had a woman as a manager or as a supervisor, they were more understanding, and it really helped them sort of perform better. Now, what were the top 3 barriers? So this is the comparison across the 3 sites that this study was done, and they found that the barriers were very similar. So it seems like the problems of women don't differ a lot, whether you look at India, Africa, or North America, although there are some differences. So the first thing they found was that lack of women role models was more highlighted in India than as compared to, let's say, North America, but even worse in Africa. So women just, they all mentioned that they didn't have people they could look up to or from whom they could learn that how they can sort of overcome these challenges. The second important issue which was highlighted was gender discrimination at the workplace. They felt that there were a lot of biases they were experiencing, and this again, as you can see, was quite high in India. Nearly 46% of them mentioned, which is nearly half of them. They mentioned that there was some sort of bias and discrimination they faced at the workplace, much lower in North America and even higher in Africa compared to India. And finally, harmonizing personal responsibilities with work. I found this very interesting because I would have thought this would be more for India. But interestingly, it is, compared to North America, it is less for India. So what it tells you is that yes, most women are struggling with the balancing these roles, but that is a universal thing. That's not specific to India. But where the difference is more on the kind of environment they have at the workplace and the role model. So that seemed to be something which has changed in the West, which has not happened in India yet. But I think our mothers and mother-in-laws are pitching in, I guess, and that's why this number seemed to be lower compared to maybe, you know, a lot more nuclear family in the West, I guess. They have to do everything themselves. Yeah, so this was an interesting observation, and the authors highlighted that there were some issues which were very specific to India, which were not mentioned by the women from by the women from other countries, and the pressure for early marriage and to have a kid early. This was emphasized a lot more by the Indian participants compared to Africa and North America. Family influence and social norms. They felt that if they came from family background where there were no women in the workspace and no role models, it made it harder. And I think I will personally vouch for that because, as I told you, my mother was a school teacher, and to me, going to work was not a question of yes or no at all. Like, I felt this was normal. Like, all women got up in the morning and left the home. So I was not used to seeing my mother with me all the time. But my mother-in-law is a homemaker. So when I had to go back to work, it used to be 5.5 months maternity leave when my son was born. So I had to join the work back. So my mother-in-law was kind of very shocked. He was like, "You sure you are going to work? He's only 5 months." So I was like, my mother went to work when I was 3 months because those days maternity leave was only 3 months. So I think it makes a huge difference on the home environment. Social norms do play a great role. I think this is repeatedly highlighted in a lot of research that comes out. Bias at the workplace, this was highlighted a lot more by women from India compared to the other, let's say from North America. And this is very interesting. A lot of Indian women said that being young and being a woman is a double problem, that you are not taken seriously. So I think many of you in this room might have experienced that. It's like, you don't know anything just because, you're very young and you're a woman. So women felt that that was a very big challenge for them because when they were trying to prove themselves to move up the ladder, if they were not taken seriously, they had to struggle more to move to the next level. But the study also identified some of the solutions. And I think that is what I would really like to focus on. And they said that, okay, we can't fix everything. I'm sure the societal changes are going to take much longer time. But can we fast track those changes, and what is that we can do about it? And 3 things which clearly came out of that, and I'm very happy, first one is happening here right now, is really networks for women. That women should have opportunities to interact with other professional women in their own profession or similar professions, and having that interaction actually empowers them, gives them more confidence and courage, and also they have people they can reach out when they have doubt, when they have something blocking them in the mind, what would you do in this situation, and sometimes that small talk can make a huge difference. The second being safe spaces to build networks. So one of the other thing which was highlighted a lot was that women find it very difficult to have open conversations. Like they're not able to talk about their problems. So sometimes if they are in the networks or meetings where men are also there, but then if they feel that the men may get upset if I say something, so they try to be politically right. And that actually doesn't help. So they should be able to really talk about what these challenges are. So it's not that they should only talk to women, they can also talk to men. But the fact that space should be such that there is an understanding that, we are here to find solutions and not to blame anyone. And finally, access to mentors, which is very achievable and a doable intervention. And I think I've been very lucky, so I can't sort of complete this talk without mentioning that I have had a very good mentor. As you know, Dr. Soumya Swaminathan, who was a former chief scientist, WHO, and also my boss as a DG ICMR. And in a very recent, this was one of the articles that came, I think in 2020, where she mentioned that our institutions are very patriarchal. So her journey as a medical researcher, as a public health researcher, she actually felt that she was not taken seriously. She said the same thing: when you are young, you are not taken seriously. And people think that like they can just ignore whatever point you are making. And it wasn't easy to be heard as a young researcher and as a woman. And she felt that she was often talked down to or had her ideas dismissed, which is so consistent with all that has come from that study. And I think we are lucky as we have more and more role models. We said we don't have enough role models, but yes, I think we are making some progress. And the other really important role model, I don't know, this is not moving? Okay. The other important role model for women in medicine has really been Dr. Gagandeep Kang. She gave a talk day before yesterday at our Indian Institute of Science Women's Day event. And she's truly been inspirational for women. And this is her quote that I really like, and that's why I put it there: the importance of role models. You cannot be what you cannot see. So women need to see other women doing those roles, which makes them more comfortable about that. And we all can make a difference in our own little ways. So this was the team where I landed. I used to be often the only woman. I was one of the few women scientists in my office. I had very good male colleagues, so nothing against men, but I always missed having some women to talk to, because I felt, especially when my kid was young and I was struggling with this homework, especially travel, because public health research also involves a lot of travel. And I used to really feel jealous of all the boys around me, because they'll just tell their wife, she'll take care of the kid, whereas I had to think who will cook the breakfast, who will do this, who will do that. So I consciously made an effort, and when I left ICMR very recently, this was the team I had. So I'm very happy that, I took a lot of effort to bring more women into the team and nurture them, and it has been a very gratifying experience for me. And another important gratifying experience that I want to share, and Anita will be there in the afternoon as well. She's the third from in the middle, I'm not able to point out. So she's doing a talk in the afternoon. She's from Biocon. So this was really a very, very good program, and I think there should be more of such programs. That's why I'm highlighting this. You should actually talk to this group and see if you can do something for women in STEM. This is an excellent program where they actually take mid-career women, and it's mostly virtual, where you have some mentorship sessions, some coaching session, and some group sessions where you're introduced to a lot of the ideas which are not technical essentially, but which help women become better leaders. And my own reflections from this journey was that there were many things which I had not reflected enough about, which I learned through this process. And what I felt was that most of us are very, very technical, especially doctors. I'm sure many engineers and others as well, and also the researchers who work in the core science. But as you move along the journey, you need to move from purely technical to also non-technical skills. And we don't have the sort of time to reflect on that and develop that. It's not that it's difficult, but are we bringing that into our mind space, that this is something I need to do? And what I felt I learned from this journey was really the importance of expanding the mind and expanding the mindset, but also expanding the skill set. And I think some of the very important reflections that I really wanted to share was things which I did not give so much importance. Things like self-awareness, understanding, like, not just what your strengths are, what your limitations are, and then what you can do to overcome those limitations. No, nobody is perfect, but are you aware? I think the problem is when you don't know what your limitations are. I think if you know your limitation, then actually it gets easier. Being resilient, I think, very, very important. And in this particular training, we talked a lot about various dimensions of resilience. Resilience, physical, mental, psychological, social, all those aspects of resilience which women need to focus on. We don't give enough importance to that, at least I feel. In my own circle of women who are doctors, I don't think we give enough importance to that. I'm sure it's same in the other professions as well. Importance of developing others. See, as you go from sort of early to mid-career and higher level, I think you also need to consciously make an effort to develop other women around you. Networking. I never used to go for conferences, I'll be very honest. Now my son is 18, so I go wherever. But I used to think if I have to sort of trade my time between home and work, I would rather use the time to get the work done than go for a meeting or a conference. But I learned in this sort of journey that networking is very important for the professional growth. Strategic skills, we quite often don't give importance to. We think that we know our field well, but I think it's not enough. At a certain level, you need to have a much broader strategic perspective, a bigger picture about your area of work, your profession, internally as well as from an external perspective. And really expanding the mindset, thinking beyond. Like, whatever area you have been working, I felt that looking beyond that and thinking about very diverse dimensions of what your profession, but even beyond your profession. And I wanted to end this with really on public health note, because I'm a public health professional, and I think women often neglect their own health. It's a very common thing. I've been like that also, and of course I've changed over years. But I think let's take a resolution, and at least of those who are here in the room, I hope you should take this International Women's Day to take a resolution that you are also important. We always keep thinking about others, whether it is work, whether it's family. Your own health is important. And it's not just physical health, it's also the mental health. And yeah, so one of the things which is happening is that as our life expectancy is increasing, up to menopause, women have some protection from diseases like heart disease, but after menopause, their risk is same as men. So, and sometimes even more if they have not really taken care of all the risk factors which can put them, at higher risk of getting heart attack, stroke, bone disease, joint disease, and so on. So really you have to see that, these are preventable diseases about which something we can do. And diet and physical activity is really the way to go, healthy diet. Not to forget the fact that, across the life course, women's health is a big issue, and I really want to highlight this problem of anemia, because 55% of Indian women are anemic. It includes even women from middle class, not just women from lower socioeconomic strata. So looking at health as a very lifelong journey is important. So good nutrition right from the young age, focusing on the making sure that women are healthy as they go through their pregnancy, childbirth, and so on, because anemia is one of the big predictors of how safe your pregnancy and childbirth is. And then comes our big challenge of, trying to maintain your weight, because that is the simplest thing you can do to prevent hypertension, diabetes, heart disease, stroke, and so many problems. And of course, bone and joint disease as you grow old. And healthy lifestyle, when I talk about, most of us don't have the time to go to gym, I know that. So buy a fitness band and count your steps. That is the simplest thing you can do, and I feel it is very powerful, because in public health we say what gets measured gets done. So once you are measuring, you actually start thinking about it. Okay, how many steps did I reach today? So simple things you can do. Take steps in the place of elevators. Take a walk around your wherever your workspace is. Use every single opportunity to get your steps done. So even if you can't find time for longer exercise, making physical activity really part of your lifestyle is a better way to go. You can move to a standing desk, which we did a couple of years ago in our own office, literally for everyone. Of course, 150 minutes of walking or any brisk sort of physical activity is good for you, but just do whatever you can. Rather than thinking that, I'll either do the ideal or not do at all, every step matters. So more and more data shows that as your activity level increases, your overall health improves in every sense. And of course, healthy diet becoming very, very difficult nowadays with so many food options. But focusing more on fruit, vegetables, and a diet high in protein, very important for everybody, and especially for women. And not to forget the big challenge of mental health. We have to remember that we are one of the few countries where the suicide rates among women are actually higher than men, especially in the younger age group. And I lost one of my staff. It was a very big shock to me, because I interact so much with them, but I think there are such complex social environment that we live in, and the pressures between career, home, going through this whole transition, it was really a sort of knock on the door for me that how I could lose. This was a 24-year-old girl, very bright statistician in my team. But the data shows that the southern states actually have very high suicide rates, especially among women. We need to keep that in the back of our mind as we interact with our staff, our colleagues, our friends, that every problem should be taken seriously, in the sense that if you think that someone needs help, do what you can to get them help or to seek help if you yourself you think you are going through a challenge. And domestic violence, something we don't talk about. Even women in middle class experience domestic violence in India. Nearly 40% women experience domestic violence, which has a huge impact on their mental health, and many times quitting the work. So if people are quitting job, you really need to, if you can, try to find out why they're doing it, because they may be experiencing a lot of domestic violence at home. So just to end, so I think women should seek help. There's a lot of data now which shows that go out and ask for help. Don't hesitate. Don't think you have to do it all by yourself. Taking help from parents, in-laws, whoever you can. Recovering from failures, good relationships at work, and of course, nothing is personal. We all have challenges. And just want to end with this, one of the icons, feminist icons, who has been very inspirational for women in medicine. She was one of the first doctors from Chennai. She graduated from Madras Medical College in 1912. And I think we stand on the shoulders of these women. And some sir mentioned ISRO. I think we have role models all around us. We just need to look out for them and learn from them. And I think these are my really key messages. Find mentors, build networks, develop your support systems, take care of yourself. Don't forget yourself in this journey. And finally, don't underestimate the importance of soft skills. Thank you.
anemia, you said, is prevalent at 55% for women.
Yes.
What is the corresponding figure for men? Any idea?
There is data, but we have more data because the National Family Health Survey is only doing anemia prevalence for women. They don't take the blood samples from men. So this data is from that. Although there are smaller studies, but we don't have like a national prevalence for men.
Yeah.
So the National Family Health Survey surveys women between 15 to 49 years of age group, and predominantly their focus has not been on the reproductive and child health indicators.
Thank you for your talk. I would argue that, we keep discussing the same thing again and again. We know the solutions. It's just like the laws of India. We have perfect laws. The failure is in implementation. So it's the same. We know the problems. We know the solutions. There's zero effort in implementation. We like to have schools like this, networks like this. But when it comes to concrete steps, to give you a simple example, 1990, Germany was a developed country. The number of women in academia or in universities was dismally low. They identified the problems, exactly what you say, support systems, networks. They created care centers within the universities. They gave longer work leave for children. They created society role models, right from funding agencies to the science minister. There were a series of women. Within 20 years, there's a sea change.
Absolutely.
We know the solutions. It's just we don't want to implement it.
Well, I think it's not that we don't want to. I mean, maybe we are not doing enough to implement it. But I do see there has been small change. Even the fact that we are in this room and we are talking about it, I think that is a
This
change.
should be on mission mode if you're serious. And now we know technology has improved so much. There can be hybrid work mode for women.
Absolutely.
When it is necessary, give them longer work. For instance, in the Scandinavian countries where teachers are greatly valued and a large percentage of women teachers exist, they have a long, it's up to them to decide when they want to come back to work. And now that they know that hybrid work modes can be leveraged, they tell the women, it's up to you, try coming to the school 2 days a week, the rest of the days you can teach from home. So,
Yeah, but I think the issue is much more complex. See, for instance, I can give you an example. I was in ICMR under central government, right? So they introduced childcare leave. It was introduced maybe sometime after the 6th Pay Commission, sometime in 2010, 11 or whatever,
Yeah.
right? But there were only 10% of the central government employees are women. So they were the beneficiaries of that. But it's not dramatically increased. Slowly the representation is increasing. So as much as I understand all these policies make a difference, but I think there is much more complex
correct.
socio-cultural issue which is very difficult to address.
Sure. So one of the things that I would add to your take-home messages is change mindsets among the men, and especially in schools.
Yes, absolutely.
Right? And then the last point I wanted to make, there's enough data. For instance, UNESCO has done a worldwide study on the gender gap in science.
Right.
Across streams, across countries and so on. But I don't know if our academies or if our policymakers have even looked at it.
Yeah.
Thank you so much for this very nice discussion. In the interest of time, we might have to move on. Thank you so much. Please put your hands together.